Hey, beautiful people. So, I'm going to go ahead and do a presentation real quick on a topic that is very familiar to us all, whether you're in the counseling profession or whether you're a social worker. I assume this will be able to help you guys connect and deal with a very specific population, and that is the LGBT population. First, I want to go over the importance of cultural competence when you're in the counseling and social work profession and you're dealing with diverse populations. So, first and foremost, cultural competence care is essential when you're serving vulnerable populations in general. And we're going to put the LGBT population in that category because they're normally faced with unique mental health challenges due to the stigma and discrimination that they're faced with. Sometimes, as counselor, we're tasked with creating affirming and supportive environments where clients typically are not maybe respected, and then their mental health concerns are exacerbated. And sometimes we need to learn how to address them with sensitivity. So that is what this training is going to do, or allow you to have better knowledge on how to do. We're going to focus on how to effectively work with this population in ways that aligns with your specific profession. So let's move on from here. And if you have any questions, of course, hit me up in the comment section. Ask me. I'll be more than happy to elaborate or come back and revisit, or just see what I can do to assist you with maybe sending out some more additional information that can help you with this topic. So first and foremost, we want to identify the developmental models that you deal with or utilize when working with the LGBT population. And that is the case model of sexual identity development. This model helps counselors and social workers alike understand the stages of identity development, understanding that clients in this population go from identity confusion to identity synthesis. And as a result of this, it can impact the individual's mental health. So counselors should be very familiar with this model. They should understand how sexual and gender identity development can impact how a client navigates throughout life. And then we also want to help this client go through the different stages so they can understand and navigate coming out. They can navigate acceptance in who they are as individuals and help address self-esteem issues. So when we're looking at lifespan, think about it. You have Freud, Piaget, you have all these people who go through the different stages of development, and they talk about the different lifespans. Now, the LGBT individuals, they face unique developmental milestones at each stage of life. So you have the adolescent who might be coming out, they're dealing with bullying, maybe in middle school, high school years. And then you have the adult who might have issues at work. They might be dealing with discrimination or, different relationship dynamics, coming out to their family, addressing how their parents might deal with their sexual orientation and how they connect with others. And for older LGBT individuals, which we typically don't hear society talk enough about, they deal with challenges as it pertains to the healthcare access, feeling isolated from others and navigating through that long-term healthcare process. So let's talk about some multicultural counseling and how we can help the LGBT in affirmative care. We're going to go over a few things. First is intersectionality. The LGBT individuals often experience multiple layers of marginalization. Their sexual orientation, how they gender identification, how they intersect with other identities such as their race, their class, if they even have a disability. This affects their overall mental health and also how they might have access to care. Then we have another model, which is the minority stress theory. This theory talks about how LGBT individuals experience chronic stress due to societal stigmas. They're discriminated upon, they deal with rejection. It leads to higher levels of anxiety, depression, and sometimes substance use. So counselors and social workers alike must be aware of how minority stress impacts the client's overall well-being. So your role as a counselor in affirming counseling is to specifically acknowledge these stressors and help the client process their experiences in a safe and supportive environment. That is key. As a counselor, you have to make your client feel safe. They're already dealing with the world, outside world, as it pertains to discrimination, being marginalized in a lot of different areas and communities. So your job is to make them feel as safe and supportive as possible. And that is pretty much what the multicultural counseling affirmative care model allows you to do. When we look at some key competencies that you must have when working with LGBT populations, first and foremost, and this is pretty much all of us counselors and social workers must realize that we have to be aware of our own biases. Let's be real. Sometimes as counselors, we have a problem with working with certain individuals. So we must be first aware of if we have any personal biases. So counselors should be mindful of any personal things they might have towards a specific population. And if they have any unexamined biases, maybe they don't even realize that they're biased when it pertains to certain things. So this is something they really want to figure out prior to working with the LGBT population, because you don't want to hinder the effectiveness of the treatment they should be receiving. Counselors and social workers alike must also have knowledge of LGBT specific issues. In this profession, we must stay informed about the unique challenges the LGBT population may face. And that can be dealing with health disparities, mental health issues like having higher rates of depression and anxiety, and then those social factors, how they might be discriminated upon when it pertains to their family, dealing with rejection, not being accepted. These are things that we have to be aware of and help as it pertains to our clients. Affirmative therapy skills. This is basically using language that affirms a client's gender identity and sexual orientation. So we're creating a space where the client will feel respected and understood, and we're affirming who they are as an individual. Empathy and active listening. Clients may be processing complex emotions, and sometimes this is pertaining to how maybe the outside world is perceiving them, but also how they are identifying with themselves. So, active listening and being non judgmental and just helping them build support and fostering that trust with their therapist is going to be extremely, extremely helpful. So, these are some of the key competencies you want to have as a counselor when you're dealing with the LGBT population. So, let's go over some of these modalities. Cognitive behavioral therapy. CBT helps clients first identify and then restructure their negative thought patterns as it deals with maybe some internalized homophobia they're dealing with, or some transphobia, or just experiencing of discrimination overall. This modality is effective for helping individuals manage their anxiety, manage their stress, and of course, trying to help deal with some of those self-esteem issues they might be faced with. Acceptance and commitment therapy, ACT. So this promotes a self-acceptance, and it also promotes and encourages clients to commit to value driven behaviors despite any of the challenging emotions or pressures they feel from society. This is also beneficial for the LGBT population when they're dealing with rejection or marginalization. Narrative therapy. So, narrative therapy is probably one of the most popular forms of therapy that we will utilize with these clients. And it focuses on helping clients rewrite their personal narrative as it's been influenced by societal norms. So the LGBT individuals can reshape their negative stories they have been internalizing and telling themselves over and over about their identity, and then foster a more positive self-image. So with narrative therapy, they're kind of like rewriting their own story of who they are. And then we have trauma-informed care. So many LGBT individuals experience trauma-related situations as it pertains to their identity, such as bullying, family rejection, and even violence. So trauma-informed care ensures that therapists understand the impact of these experiences and respond to these clients with empathy and with care. And family systems therapy, which is very, very common amongst the social work population. This is when the family dynamics can be so complicated for the LGBT individuals. So the therapist wants to help them deal with some of that family rejection. So with family systems therapy, we help the client and their families navigate these challenges and help foster more of a healthy relationship. So, of course, as we deal with different competencies, the different modalities, we have to consider the ethical and legal issues that come about when dealing with clients in this vulnerable population. So, some non discrimination, we have the American Counseling Association Code of Ethics. It mandates that counselors provide equitable care to all clients. This is regardless of sexual orientation or gender identity. They must actively use this to avoid discrimination. Confidentiality. LGBT clients, especially minors, may not be out to their families or their communities. So us as counselors, we must handle this information about the client's sexual orientation or gender with the utmost confidence and confidentiality to protect for privacy and safety purposes. And then we have informed consent. Counselors must clearly communicate their approach to affirmative therapy and make sure the client understands their rights as it pertains to confidentiality, care, and support. And then one of the last ethical and legal issues we want to consider is advocacy. Counselors should be prepared to advocate for their clients, especially when they're facing systemic discrimination in the healthcare system, employment, and education. This advocacy role is a vital part of ethical practice. We're going to scroll down a little bit and we're going to talk about how you can apply these ethical principles in practice. So here goes a case study, and I'm going to give you time to think about it so you can pause the video or stop it and just kind of read through it yourself. So we have a 17-year-old LGBT client, Alex. He comes to counseling for anxiety, but has not come out to his parents. They fear family rejection and their sexual orientation is revealed. So they fear being rejected by their family. So they're just not ready to tell them what's going on. Let's talk about it. How do you handle confidentiality with a minor who is not out to their parents? Do you tell the parents anyway? Absolutely not. In this case, you're going to have to assist the client in finding a way to collaborate with their parents so they can come out and explain to them or express to them what's going on, maybe with the support of their therapist. And if that is not an option and the client does not want you to share what's going on, then you have to respect the client's confidentiality. Remember, the client is not at risk of hurting himself or herself or themselves or anyone else around them. So it's not like an imminent threat or need to report what's going on. You would just kind of work with that client and giving them ways that they can eventually get over some of their fear of their family rejection. And if it's something that's not possible, their family is going to reject them either way. Maybe it's religious reasons, cultural things. I'm not sure what it could be. You want to help the client process through this and figure out ways that they can maintain or ways that they can handle the situation that they're dealing with as it pertains to their family, because it's not guaranteed you're going to be able to get the family to conform and to come to understanding of what's going on with Alex. All right, what steps should you take to maintain the client's trust while ensuring their safety? Just reassuring them that you're their person. You're their therapist. You're not their parent's therapist. Your job is to help them get through the steps they need to deal with the situation at hand. And just ensure them that you're not at liberty to tell and share this information that is discussed in the session unless they're at risk of hurting themselves or someone else. So you're kind of reassuring them that you're there to handle what's going on and that they do have your confidentiality at hand so they understand that you're not going to share and express those things. Last question, how do you balance ethical obligations to a client and any legal requirements regarding minors? That is a very, very, very tricky one. And when you're balancing ethical obligations and legal requirements as it pertains to the minor, you want to always be upfront and let them know your role, what you can share, what you cannot share. What does that look like? When is there a legal issue that requires you to overstep the situation at hand and maybe express or share something with the authorities? If this individual, the 17-year-old, was maybe involved with a 30-year-old person, and obviously that's a legal issue. And then also ethically, you do have to keep the client's information confidential and you're not supposed to share things. But in this case, are they at risk of hurting themselves or being hurt by someone else? Those are the questions you have to ask yourself when you're dealing with ethical and legal situations with clients. So let's talk about building effective therapeutic relationships with LGBT clients. There are 3 things that I want you to consider: empathy and validation. So first and foremost, your clients might feel discriminated, isolated, and dealing with a lot of trauma. So your role is to validate that these experiences, what they have had happen to them, is not just a small thing. And you provide them that non-judgmental support and let them know that you're there so they can learn to trust and feel safe around you. And then you have the client-centered approach. We got good old Carl Rogers up in here. And one of the conditions, the core conditions of this approach is empathy, unconditional positive regard. We all know that. And that congruence, that helps build that strong therapeutic alliance. So this approach is very, very useful when working with the LGBT population, because it really helps them process some of those identity-related concerns when they know you as a therapist have that unconditional positive regard. that just helps tremendously with them being able to be free and sharing and expressing themselves in the sessions with you. Affirmative therapy practice. So, affirmative therapy is an approach that validates and affirms a client's LGBT identity. And we talked about that in some previous slides. So, by actively supporting the client's self expression, the counselor encourages a positive sense of self. And this truly, truly helps the clients get to a place where they feel safe and comfortable with you. Now, if you're doing group counseling with the LGBT population, you want to create a safe space for that process. You want to set the ground rules. You want to discourage that homophobia and that transphobia and any other discriminatory behaviors, and let them know what the rules are in that group so everyone feels safe. And then there's also support groups where you can recommend and refer your clients to. So they have specific support groups that can provide a sense of community. They help reduce with some of that social isolation. And they also help clients develop some good coping skills. So that can kind of help them feel validated and appreciated around their peers and other individuals that might be experiencing what they're dealing with. And then you have the trauma-informed group therapy. A lot of LGBT individuals have experienced some type of trauma-related situation as it pertains to their identity. So with trauma-informed group counseling, it ensures that the group sessions are sensitive to the emotional triggers and the needs of everyone that is participating in that group. Advocacy and continuing education in the LGBT counseling. So with advocacy, counselors should advocate for the LGBT clients, whether if they're dealing with the larger system. So if they're dealing with situations at work, healthcare, school, so forth, this is where advocacy provides that supportive environment and social change aspect for clients. Continuing educations. As counselors, you should pursue ongoing education. So although you're sitting in this training, we're discussing some key elements, you as a clinician should continue to take your CEUs and your CEs and so forth to help you better understand how to relate and how to connect with clients in the LGBT population. Very, very helpful. And then also community resources. There's tons of resources out there. There's websites, there's support groups, there's other professionals that you can refer and get information from and learn about all the legalities and the different things that healthcare providers are assisting or helping with. There's just so much information out there. Definitely want to make sure that you connect with some of the community resources. And last but not least, there's some common questions related to LGBT care. So I'm going to ask you 2 questions. See if you get these answers, and then we're going to wrap up this presentation. It's been about 20 minutes. I'm glad I was able to hold your attention. Hopefully it was helpful. Hopefully you got what you needed. And if not, continue to study, go back over the information, pause it, reread it, mute it, read it yourself. Whatever it is, this information is going to help you get to the next level in your profession as it pertains to dealing with the LGBT population. Question number 1. So, a client has recently come out as a transgender and is struggling with gender dysphoria. Which therapeutic approach would be most beneficial for this client? A, exposure therapy. B, cognitive behavioral therapy. C, psychoanalytic therapy. And D, behavioral activation. Go ahead and pause the video, think about it for a little bit. What are you thinking? You are right. It is B, good old CBT, cognitive behavioral therapy. That is the best approach when dealing with a client that's struggling with the gender dysphoria. Let's go on to question number 2. In multicultural counseling, which of the following best describes intersectionality? Is it A, understanding how clients' multiple identities, such as race, sexual orientation, affect their experiences? B, focusing solely on a client's sexual orientation in therapy? C, addressing the client's mental health diagnosis only? Or D, none of the above? And guys, like I tell you, when it comes to test prep, sometimes the answer is right there in the question. And this question just screamed the answer. It says in multicultural counseling. So first of all, it's multicultural. We're dealing with multiple cultures. Which of the following best describes intersectionality? And the correct answer is A, understanding how a client's multiple identities, such as their race, sexual orientation, gender, all those things affect their experiences. All right, guys, I hope this was hella helpful to you. Please stay connected and keep learning. Follow us on social media. For those of you that are not on Instagram yet with us at LCSWVIBES.com, remember both of these pages and both of these sites are very, 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 very new. So for the first 50 subscribers, I'm giving away a free study guide. So follow us on social media. In Instagram, you can send a direct message saying test prep, free test prep. And then I'll ask you for some additional information and go ahead and send that to you in email. And if you're on YouTube right now, after you watch this video, you can like, subscribe, and in the comment section, say free test prep. Boom. And I will actually tell you the next steps to give me your information so I can go ahead and send you the free test prep. So also visit our website for courses and coaching and connect with us. If you have any collaborate, you have anything else going on, please, please, please hit us up. We'll be happy to discuss. You have an amazing day. Thank you so much for participating in this training, and I'll talk to you soon.